Welcome to our session on lifestyle medicine, a prescription to prevent the perfect storm. COVID-19, first discovered in Wuhan, China, has now spread world over and has resulted in 246 million people being infected with the virus and 5 million deaths thus far. Now, an uncontrolled COVID-19 infection can trigger a cytokine storm. So what is a cytokine storm? In a cytokine storm, what happens is that there are the pro-inflammatory cytokines and chemokines are overproduced by the immune system. Now, this results in multi-organ damage and coagulation abnormalities that can lead to thromboembolic events. Now, this can present as comatose, stroke, heart attack, cardiac arrest, embolism of the lungs, and Kawasaki syndrome in children. Now, when this uncontrolled COVID-19 infection or the cytokine storm takes place in a person with a chronic disease, this sets the stage for a perfect storm where this uncontrolled inflammation is aggravated. Now, in a study published in the Lancet Global Health, it is suggested that 1 in 5 people are at an increased risk of severe COVID-19 should they become infected, mainly due to underlying chronic diseases. So why does this perfect storm occur in people with chronic diseases, or more likely in people with chronic diseases? Because fundamentally, people with chronic diseases or NCDs have a dysfunctional immune system. They have an impaired immune response to infection. There's an increase in inflammation. There's ongoing chronic inflammation, and it is prothrombotic in nature. So when you have an acute infection, such as COVID-19, taking place in the background of chronic diseases where there's ongoing chronic inflammation with a compromised immune response to infection, this leads to the perfect storm. Let's look at some data on COVID-19 and NCDs. So what is the risk factor for the severity of disease in people with diabetes? Twofold increase. What about risk factor for hospitalization? 12 to 16% increase. And mortality, threefold increase in patients with diabetes. Moving on to COVID-19 and hypertension. Hypertension is the most common comorbidity, and twofold increase noted twofold increase in severe cases in ICU. Now, COVID-19 and obesity. UK Biobank data shows that being overweight increases the risk of COVID-19 by 44%. And in a study, it showed that 41.7% of hospitalized patients in New York City Hospital were individuals with obesity. Now, the data that we are talking about today is not new. This has been seen in previous pandemics in the past 20 years. The past 20 years, we have seen SARS, influenza A, and MERS. And time again, we've seen the same scenario. Now, this scenario is repeating itself because, unfortunately, the NCDs continue to rise. And so when we hit the next pandemic like we did now, right, the same scenario plays out again, increased morbidity and mortality in patients who have chronic diseases. Now, COVID-19 will cease at some point, but at some point in the future, we will again face another pandemic. So what's going to happen again? Now, the chronic diseases currently are rising at an alarming rate. And again, patients with chronic diseases will be at the risk of the perfect storm or an aggravated cytokine storm, which will increase their morbidity and mortality. So basically, the NCDs are drivers of these pandemics, and we need to address these drivers of the pandemic, and we need to address the drivers of the pandemics way before the pandemic comes into place. So how are we going to address these drivers, these chronic diseases? So of course, the first thing that we want to do is we want to try and prevent the rise and in fact reverse the trend, right? So we want to look at people with hypertension, hyperlipidemia, coronary artery disease, diabetes, obesity, right? And of course, we want to make sure that our immune system is enhanced and optimized. And when we're talking about an optimized immune system, we always need to take into account our gut flora, right? Our gut flora is very important as part of the immune system. We'll talk a little bit more about that in a while. All right, the good news is that 80% of lifestyle diseases can be prevented, managed, and reversed. Our immune system can be enhanced. Is the question is about doing the right thing. And so how are we going to do the right thing, right? So lifestyle medicine is an intervention, all right, that helps us to prevent, treat, and even reverse diseases, and boost our immune system or enhance our immune system by replacing unhealthy behaviors with positive ones, right? So lifestyle medicine is an evidence-based therapeutic intervention that promotes the use of a predominantly plant-based diet, regular physical activity, sleep, stress management, avoidance of tobacco, and moderate alcohol consumption, and positive social connectivity. Now, looking at diet and nutrition, well, many studies show that diets high in saturated fat, sugar, refined carbohydrates contribute to the prevalence of obesity, type 2 diabetes, and more. This, of course, increases the risk of severe COVID 19 pathology and mortality. It impairs the immune system. Okay? And so, in order to address this situation, we need to change the way that we are eating. So, what is prescribed is a whole food plant based diet, right? Where half the plate is filled with fruits and vegetables, the quarter of the plate has plant proteins, and the other quarter of the plate has whole grains. Now, incorporating plant proteins is important because plant proteins are not only high in fiber, for example, the legumes, all right, but they also are converted to short chain fatty acids. This fibers helps to convert into short chain fatty acids, which produces butyrate, and this helps us with the management of chronic diseases. Now, published studies show that intake of fruits and vegetables, which are rich in antioxidants, which are anti-inflammatory in nature, which are rich in vitamins and minerals, are associated with a lower risk of inflammation. They are also able to importantly modulate the immunological response. So modulating the immunological response becomes very important in situations like COVID-19, where the immune system is too ramped up at some point, right? And also helps to reduce the inflammation. Of course, a plant-based diet contributes to the lower risk of heart disease, diabetes, cancer, and more. Now, evidence also suggests that large amounts of fruits and vegetables and a small amount of meat consumption can reduce the risk of thromboembolism. Again, this is important considering the fact that in COVID-19, especially against the background of chronic diseases, clotting is an issue. Now, as we live with COVID-19, or as the pandemic stretches on and as people recover, we are beginning to see that there is a group of patients who are suffering from long COVID. And it's also postulated that the peripheral inflammation caused by COVID-19 may have long-term consequences, which may lead to dementia and neurodegenerative diseases. We know that neuroinflammatory mechanisms can be compounded by an unhealthy diet. Hence, having a diet that's anti-inflammatory in nature, which is plant-based, helps to reduce the inflammation, helps with the healing associated with long COVID. Let's talk a little bit about our gut microbiome. So our human body is host to more than 100 trillion microorganisms. They play a role in our health, and they can play a role in disease state as well. Okay? Now, a large portion of our immune system is in our gut. Now, this is our first line of defense. Now, we should have a proportion of approximately 70% good bacteria and 30% bacteria. But if our lifestyle is not optimized, what's going to happen is that we are going to have a imbalance in the gut bacteria. So we're going to have dysbiosis. So having dysbiosis means poor immune system. So optimizing the gut bacteria will help to improve the immune system. This will help us ramp up our immunity towards the infection. It also has a role to play in it being anti-inflammatory. Not only that, it has now been shown that the gut bacteria can play a role in preventing chronic diseases or helping to manage chronic diseases, for example, like diabetes, obesity, and more. And vitamin D, this is an important vitamin that we may want to talk a little bit about. So vitamin D3, which is inactive, is produced on exposure to sunlight and converted to the active form in the liver and kidney. So food sources of vitamin D are a little limited. okay, mushrooms, milk. And as we age, our ability to produce vitamin D3 is reduced. Now, the important function of vitamin D is that one is that it is immunomodulatory. Again, it's able to ramp up when it needs to ramp up and is able to ramp down when it needs to ramp down. And it inhibits inflammation. Hence, it plays a significant role or can play a significant role in the management of COVID-19 and chronic diseases. Now, in a study done in the University of Chicago, they found that patients who had vitamin D deficiency and were not treated were twice as likely to test positive for COVID-19 infection as compared to the group that had sufficient levels of the vitamin. Now, again, another study shows that the lower the vitamin D levels, the higher the incidence of morbidity and mortality. So, negative correlation between vitamin D levels and mortality and morbidity. Curcumin. Curcumin is a herb that we may want to incorporate into our diet. It is an extract from turmeric. It has multiple health benefits. It is primarily acts through its antioxidant and anti-inflammatory mechanism. So it is a very powerful anti-inflammatory herb. Best taken when it's combined with pepper, which is called piperine, and it is something useful to incorporate into our diet. Now, moving on from diet and nutrition to physical activity. So, as we evolved, as man evolved, what happened is that we became more and more sedentary. As technology evolved, we became more sedentary, right? Now, as we became more sedentary and only exercise our fingers on our computers, tablets, and smartphones, what happens is that we increase the risk of physical and mental illnesses. So, a sedentary lifestyle has an increased risk of physical and mental illnesses and also compromises our immune system. In fact, sitting is the new smoking. Now, physical activity is responsible for between 6 to 10% of NCDs, and due to the lockdowns world over, inactivity has been accentuated and worsening of medical conditions. Okay, so incorporating physical activity into our daily life will help us with our mental health, will help us with our physical health, and will help to boost our immune system. So 40 minutes, 5 times a week. So we'll have about 200 minutes. Optimum should be about 210 minutes a week of exercise. Now, some studies show that moderate intensity exercise reduces inflammation, improves immune function, and decreases the risk and severity of respiratory infection. Now let's move on to stress. So what's the relationship between stress and disease? So as stress activates our neuroendocrine and sympathetic pathways, okay, resulting in the production of cortisol, adrenaline, and noradrenaline. At the same time, what happens is that the parasympathetic nervous system is inhibited. The neurotransmitters, serotonin, dopamine, and GABA are also inhibited. We have gut dysbiosis. There's increase in oxidative stress and inflammation, impaired immunity. Stress is also linked to abdominal obesity, insulin resistance, impaired glucose tolerance, abnormal lipids, endothelial dysfunction, vascular complications, and poor mental health. So, how are we going to deal with the stress? Pre-COVID, we had a huge amount of stress. Now, with COVID, the stress levels have increased for various reasons. The first thing that we want to do is we want to look at resetting our mind, because some situations we can't change. We don't have the control to change situations, but we have the ability to reset our mind, to reframe how we are going to look at things. Whether we want to be mindful, full of clutter in the mind and excessive thinking, or whether we want to declutter the mind and become mindful, taking only what we want to think about and having more peace in our lives. So, mindfulness, as defined by Dr. John Kabat-Zinn, the father of mindfulness, is a psychological process of bringing a person's attention to the current moment. And this can be developed through the practice of yoga, meditation, and other training. So, what happens, right, is that we need to build a resiliency kit. And one of the things that we want to put into the resiliency kit are mind-body intervention techniques such as mindfulness, yoga, guided imagery. Now, when we put that into our resiliency kit, okay, we down-regulate the amygdala, which is our stress sensor. Once the stress sensor is downregulated, this decreases the production of stress hormones and inflammatory cytokines, promotes healthy gut microbiota, increases the production of neurotransmitters such as serotonin, dopamine, and GABA. Right? Now, what happens here basically is that we are evoking the body's natural counterbalance, the relaxation response. The relaxation response is evoked when the parasympathetic nervous system or the vagus nerve is activated. Now, in this state, we have a state of deep rest, and this brings about the changes that stress brought upon. Okay, the changes that stress brought about. So, in this state, the breathing rate goes down, blood pressure goes down, heart rate, blood sugar, etc., goes down, and the immune system improves, creativity, concentration increases. Now, if we look at some studies, now if we take yoga therapy as one example of a mind-body intervention technique that we want to use, so yoga therapies reduce salivary cortisol levels. There are many studies that show that mind-body intervention techniques reduce cortisol levels, and yoga practice, where they compare novice and expert yoga practitioners, it's found that in the novice practitioners, serum interleukin 6 is 41% higher. So that means they're just beginning. They haven't been practicing yoga as compared to expert yoga practitioners, right? And they have a detectable CRP which is 4.75 times higher than the expert yoga practitioners. Also, other than mind-body intervention techniques, other things that we can do to manage our stress is doing things that we like, singing, dancing, playing some games, right? Don't take life too seriously, have a good sense of humor, and connecting with nature. Connecting with nature is very good, is a very good stress buster. And the added benefit is that if you also expose yourself to some sunlight, all right? Now, this helps with our vitamin D. Vitamin D is also useful for our mental well-being, right? Now, studies show that if you don't get enough sleep, right, a person is most likely to get sick after being exposed to a virus because the immune system is compromised, and also recovery becomes slower. So chronic stress is also associated with an increased risk of metabolic disease. A large study done in the United Kingdom by Chandler uh, showed that workers who do night shift continuously have higher levels of cortisol and are more predisposed to metabolic diseases. Now, social connectivity. Social connectivity has been shown to improve longevity and physiological parameters. How does it work? It activates our parasympathetic nervous system. So when I say social connectivity, it's actually connecting with people, not being connected on social media. In fact, excessive use of social media shows that there's an increased risk of anxiety and depression. So a very interesting study, which I would like to share with you. This is a 75-year cohort study where they compared Harvard male students and men from inner city Boston. So the comparison is these young students who have everything. They are going to a prestigious university. They will come up. They will get a good job. They will get good salary. And the guys from inner city Boston who basically don't have anything. Now, what they found was that the single most important predictor of happiness and longevity was the social connectivity. It was not their education. It was not how much money they had. So this is very important, especially during this time of COVID-19, where world over we've had various stages of lockdowns, which was essential to manage the situation. But this disconnect um, causes issues as well. And in a technologically advanced world, we are actually disconnected from people, right? So we need to put more emphasis on connection with people in person, either talking or seeing people, and not just being connected on social media. So, in conclusion, ladies and gentlemen, the global response has been to treat COVID 19 as a vertical disease rather than addressing COVID 19 and its interaction with NCDs. Given the interaction between COVID 19 and NCDs, it is important to address the underlying drivers of the pandemic that are fueling the COVID 19 mortality. Lifestyle medicine is an intervention that will help address the drivers of the NCD pandemic and help to enhance immune system, which will help us to combat COVID-19 and future pandemics. Stay safe and stay healthy, ladies and gentlemen. Thank you.